Over the past few months, we've learned there are different ways it's transmitted. So what are we supposed to do about that? Vicky Nguyen joins us now. So, Vicky, I remember when this whole thing started, we were wiping down everything, every surface, our groceries, all of that stuff. What should we be doing today?
Good news, you can save those wipes. Early on, Hoda, we didn't know a lot about how this virus was spread. Now the CDC says the risk of surface transmission is very low. You're much more likely to get the virus from someone's droplets if they're coughing or sneezing or talking at you and they are sick. So that is the good news. And remember, last month, we showed you the first ever surface test for SARS-CoV-2. We took it to a bunch of public spaces all across the country, ATMs, restaurants, gas pump handles. You see the grocery cart there. We did get some positives, but we got a lot of negatives, too, for SARS-CoV-2, the virus that causes COVID-19. So that's reassuring. The best advice now is to wash your hands after you handle any groceries, any packages. And, of course, when you're out in public, wear that mask. Study after study has shown it is effective in preventing the spread of COVID-19.
Vicky, a lot of schools are already back in session. Some are about to be back in session. There are some numbers that just came out that showed a 21% jump in children getting the coronavirus in the last 2 weeks. That's 75,000 new cases. It makes parents wring their hands a little bit. What should parents think about?
Yeah, it is nerve-wracking. What parents need to focus on and what they need to know is what's happening in their community. Is the rate of infection going up? Are they seeing people wearing masks and practicing social distancing? And when it comes to the school, ask the school, what is your plan for if there is an infection here or a COVID-19 outbreak in the classroom? 440,000 children have tested positive for COVID-19 in the United States. But the good news there is they're at much lower risk for complications. It's about who are they exposed to when they come home. Grandma and grandpa, mom and dad, anyone with a compromised immune system. These are very personal decisions that parents will have to make about sending their kids back to school. I will say we have visited schools that are the ones that are having the most success are the ones that have the most collaboration from administrators, teachers, and parents. At a school in New Jersey, they're taking everything outside, Hoda. It's not just exercise and playground time. They're doing art, reading, writing, all outside. At another district in New York, they're doing air handling systems. They're putting screens on the windows, and they're installing more sinks to encourage hand washing. So schools that are collaborating and coming up with solutions, thinking outside the classroom, those are the ones where we're seeing the most success.
All right, Vicky. Vicky Nguyen, thanks so much.